Hey everyone, we've got another heart today. The heart would have sat roughly in the chest like this, anterior surface coming out towards the screen, posterior surface towards the turntable, head or superior would have been up here, legs or inferior would have been here, this would be left and this would be right. And so why don't we go ahead and start off how we usually do, which is by trying to identify externally at least what seems to be the right atrial appendage, and that seems to be this. You can see it's kind of long, appears to be broad-based. So let's go ahead and open up the heart here. All right. And when we go ahead and open up this atrium, we do find that there are pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. And when we look down inside the atrium, we find the right atrioventricular junction, and we do see that the right-sided atrioventricular valve does appear to have had some work done. And when we look at the atrial septum, we find that there is in fact a large atrial septal defect, almost essentially a common atrium. There does appear to be a structure that looks like the mouth of the coronary sinus right here. Since we're here, we might as well just take a look at the left atrium as well. So we'll flip this heart over, and now we are looking at a smooth walled atrium consistent with the morphologic left atrium. You can see in fact that there is a large atrial communication. And we can in fact find the left atrial appendage as well. And you can see that all of the pectinate muscles are confined inside the appendage here, consistent with a morphologic left atrium. Now let's go ahead and open up the ventricle here. And now we kind of get a sense of what is going on in this heart overall. Here is that right-sided atrioventricular valve that we met earlier. So you can see some of its leaflets have been removed, although some remain intact here. And then we do find another second AV valve, which we'll call the left-sided AV valve here. And they both drain into the same ventricular cavity. And this ventricular cavity has coarse trabeculations, consistent with a morphologic right ventricle. So it appears that we are dealing with a heart that has double inlet right ventricle. And so then the next question will be, is what are the outlets to this heart? And when we look, we can see that there is an aorta here, and that here is our first semilunar valve. And remember, these semilunar valves don't have a true annulus. What we call the annulus by echocardiography is a man-made kind of structure. The annulus here is truly kind of in a crown shape, as the leaflets of the semilunar valves are actually interposed by muscular triangles. And so what we call the annulus by echocardiography is actually kind of a man-made construct when it comes to these semilunar valves. Nonetheless, we have a 3-leaflet semilunar valve here with 3 sinuses. And we can see that coronary arteries are arising from some of these sinuses as well. Okay. And so this does appear to be an aortic valve, and it does lead to the ascending aorta and the transverse arch. So here is the aortic valve, the ascending aorta, which appears to be anterior to the other outlet, which we'll see momentarily. Looking at the support of this aortic valve, it doesn't seem to have any continuity or fibrous continuity with the nearest atrioventricular valve. So this is the aortic infundibulum here. Let's enter back into this ventricle, and here we find a second outlet that is slightly posterior and leftward to the outlet we had just seen. Here we find another semilunar valve, And this one appears to have 3 leaflets as well. And so this is, in fact, the pulmonary valve. There are no coronary arteries within the sinuses here. And actually, I think I misspoke. This actually seems to be a 2-leaflet valve here. Here's 1 leaflet, and here's another leaflet, and it's just, its other portion is right here. So this appears to be a 2-leaflet, 2-sinus pulmonary valve. And then here's the pulmonary trunk. Here is the right pulmonary artery, and then the left pulmonary artery here. So we're dealing with double inlet right ventricle, double outlet right ventricle, with a normal appearing 3-leaflet aortic valve with fully muscular support, and then a 2-leaflet, 2-sinus pulmonary valve that actually has quite a bit of fibrous continuity between the left AV valve and the pulmonary valve itself. All right. So just to go through all of that again, we'll take a look at the ventricle one more time. And this time I'm going to try to add some light to it. All right. So here is that single ventricle. Has coarse trabeculations consistent with the morphologic right ventricle. We see that there are 2 inlets. Here is the right-sided AV valve. Here is the left-sided AV valve. So we have double inlet right ventricle. Then we have the pulmonary outflow here. We have the aortic outflow here. So double inlet, double outlet right ventricle. And there's been some accessory cuts made here as well. And these have been made to identify another ventricular cavity, which there doesn't appear to be one. So a heart with double inlet right ventricle, double outlet right ventricle, 2 separate AV valves. So an interesting heart.